Hi, my name is Stoda Marchiona, and for my 5th sports med project, I did lumbar spinal fusion surgery rehabilitation. A spinal fusion is a procedure in which a surgeon places bone or bone-like material in between two vertebrae to create one. He will use metal plates, screws, and rods to hold the two together while the bone heals. Spinal fusions can be done on patients with herniated discs, spinal deformities, and spinal instability or weakness. Just like any other surgery, this procedure comes with a risk of complications such as infection, bleeding, clotting issues, and injury to surrounding vessels or nerves. Pre-op procedures begin with a basic health exam, which consists of checking the lung and heart function, a blood test, EKG, and a possible chest x-ray. The doctor will also discuss any current or occasional medications that you may be taking at the time. He will also make a plan for those of how you will take them before your surgery. All blood thinners must be stopped 7 to 10 days before, and the patient will be instructed not to consume any alcohol 1 week before and 2 weeks after to reduce bleeding complications. Once the patient arrives at the hospital the day of his procedure, the patient will be shown to their room and asked to change into a gown. Next, they'll meet with the anesthesiologist and get an IV placed in their arm. Once the surgical team is ready, they'll be taken to the OR and prepped for surgery. Once in the operating room, the surgeon or nurses will scrub in and come meet you. Anesthesia will then begin, and the surgeon will make his final marks before starting the procedure. The surgeon will then make his incisions and assess the spine and decide what kind of fusion it may need. He will then use bone grafts or artificial bone-like material to fill in between the fused vertebrae and connect them with plates, screws, and rods. Finally, a member of the surgical team will close the incision with sutures, staples, or skin glue and dress the wound. Directly after surgery, the patient will be taken to the PACU, and once awakening, he will return to his regular room. The patient may experience dry throat from intubation, but he will be administered pain and anti-nausea medications after surgery. Nurses will be sure to record vitals regularly and change wound dressing as needed. If a catheter is placed, it will be removed, and respiratory therapy will start immediately to recover from intubation. Basic mobility is encouraged to start the recovery process. Depending on the kind of fusion the patient receives, he may go home anywhere between the same day to 4 days later. The patient will also be given a list of discharge instructions. Take pain meds as prescribed. Narcotics can be addictive, so look into getting a laxative, and do not take NSAIDs as they can stop bone growth and cause the fusion to fail. Patients will also be given a list of restrictions. No bending, lifting, or twisting your back for 2 weeks. Do not lift anything heavier than 5 pounds. No strenuous activity. Do not smoke, vape, or use any other nicotine products as they can prevent new bone growth and cause your fusion to fail. Do not drive until after your follow-up appointment, although you may ride in the car for short distances under 45 minutes. Lastly, do not drink any alcohol for 2 weeks while you're taking narcotic medications. Once home, the patient will have to care for their incisions. They'll be instructed to clean the incision with soap and water and pat dry. They'll have to watch for infection and not apply any lotion and not fully submerge the incision. They will be instructed to ice the incision for 3 to 4 times a day for 15 to 20 minutes each to reduce pain and swelling. The patient will also be encouraged to get up and walk for 5 to 10 minutes every 3 to 4 hours in increasing time with tolerance. Lastly, the patient should sleep on their back with a pillow under their knees or on their side with a pillow between their knees. 2 weeks post-op, the patient will go back to meet his doctor and be given some light stretching exercises to do at home. 6 weeks out, the patient will start routine physical therapy and be given exercises to help strengthen his back, such as low-impact aerobics like swimming and walking. The physical therapist will also help the patient make modifications to their daily standing, sitting, and sleeping habits. By attending physical therapy, the patient will gain strength in their back and prevent further injury after surgery. Recurrent back pain after surgery is very common. The most important ways to prevent this is proper lifting techniques, good posture, appropriate exercise programs, an ergonomic work area, healthy weight and lean body mass, a positive attitude, relaxation, and stress management, and no smoking, vaping, or other nicotine products. Due to recent research at Oregon Health and Science University, nearly 20% of people who underwent lower back fusion surgery developed PTSD. Many people who require one spinal fusion can require multiple surgeries to correct or repair their spine. This can cause a spinal fusion patient to have problems for the rest of their life, which can be extremely. That concludes my presentation. If you guys have any questions, feel free to ask them now or email me.